Alina Sutter, and on behalf of Pathways to Prosperity, I would like to welcome everyone to today's very important workshop on employment support for immigrants. I just want to mention that we now have English-French translation for our workshop, and although today everyone is going to speak in English, you can choose to have closed captioning in either English or French. So to enable closed captioning, please click on the Show Captions option at the bottom of the menu. And if you cannot see this option, you should be able to find it under the More button. So for those of you who would like to have closed captioning in French, please click on the upward arrow just next to Show Captions. And then you will have to enable translation and then select French as your preferred caption language. So this is for those who would like to have closed captioning in French. For those of you who would like to have closed captioning in English, the translation does not have to be enabled, so as we'll be speaking in English, and Zoom will automatically use the transcript to display closed caption. So before we begin, I would also like to acknowledge that Western University is located on the traditional territories of the Anishinabek, Haudenosaunee, Lenape-Paivuk, and Chongongton nations, on lands connected with the London Township and Somra Treaties of 1796 and the Dish with One Spoon Covenant BAPM. I also recognize that this is a virtual meeting, so many of you may be on a different territory. So I'm really excited to introduce today's workshop, which will feature 3 promising practices that support immigrants in securing jobs commensurate with their skills and experience. These practices have similarities and some unique features, and then our discussion will be highlighting key themes, some commonalities and unique features, and also important lessons for others to use in developing and improving their own practices. So our speakers today are, first we will have Daryl Pinto and Tony Jabbour, who will be speaking about multi-stakeholder hiring events for refugees. Daryl is the Director of Employment at Jumpstart Refugee Talent, and Tony is Senior Recruitment Partner at Jumpstart Refugee Talent. Next, we will have Caroline Duvar and Rebecca Martin-Fraser, who will present the National Healthcare Language Program. Caroline is the National Healthcare Project Lead at iSense, and Rebecca is the National Healthcare Language Program Facilitator and Developer at iSense. After that, we will have Rochelle Fletcher and Maria Skurat, who will talk about the public sector hiring initiative GNB Mosaic. Maria is GNB Mosaic Program Manager and HR Consultant, and Rochelle is HR Director for Talent Acquisition and Employee Experience in the Office of the Chief Human Resources Officer in the Government of New Brunswick. Following these 3 presentations, we will have our discussant, Devin Monroe, who will be replacing Kelly Bennett from Will Employment Solutions, and he will put together some key themes from the presentations and what we've learned. Devin is Senior Manager of Employer Services and Strategic Partnerships at Will Employment Solutions. Following Devin's discussion, the speakers and Devin will be available to answer your questions. So for that, please use the Zoom Q&A button at the bottom of your screen for inputting your questions. If you can't see the Q&A button, again, try to click on the More button, and then the option should be visible there. While we will get into the Q&A period after all our speakers have presented, you can type in your questions throughout the session, and you can also upvote questions typed by others, so feel free to do that anytime during the session. Once we reach the Q&A period, we will also address the questions in the Q&A chat first, and after that, if you would like to raise your hand and ask a question, please feel free to do that as well. We will encourage you then to state your comments, your question, and if you'd like and feel comfortable too, you can also turn on your camera as you're asking the question. So this is it in terms of introducing the meeting. So we're now ready and really excited to start with our first presentation. So over to Daryl and Tony.
Great, thank you so much, Alina. I'm just going to share my screen, and I just want to express my gratitude to Pathways to Prosperity for selecting this refugee hiring event multi-stakeholder model as a promising practice. You're going to hear a lot more about this in the next 15 to 20 minutes. So give me a thumbs up if you can see my screen. Great. So Jumpstart Refugee Talent is a charitable organization. We operate nationally across the country, in fact, beyond the country borders. We have offices in Toronto, Montreal, Calgary, Vancouver, Beirut, and Bogota. And having said that, we are still a relatively small organization with about 30 staff spread across those cities. One of the things that is in our DNA is that we really want to affect system change here in Canada for newcomers and specifically refugees. And we do this through partnerships, partnerships with SBOs, partnerships with governments, partnerships with employers. And we'll get into one of the innovative models we use with our employer engagement strategy. My colleague Tony, I'll pass it on to him later in the presentation, will talk specifically about the refugee hiring event model. So rather than talk about programs, which I could do at length, what I'm going to do instead is talk about models, two specific models that we employ that we think are innovative and are going to, we think, change a bit of our system here in Canada. The first is the dual clientele model, and the second, Tony will talk about the refugee hiring event model. The dual clientele model is, in my mind, unique, and it comes from the roots of where Jumpstart started from. We're not a very old organization. We only incorporated in 2016. We had 0 employees and 1 volunteer back then, and we've grown to 30 staff with many more volunteers today. But each of the founders of Jumpstart were formerly forcibly displaced, but they all came from the business world, as did I. I'm not a refugee myself, but spent 30 years in the corporate world, working in Shanghai, in London, in New York, and Toronto. But with that corporate experience, we've been hiring managers ourselves. We've worked with talent acquisition at large and small companies in order to hire new staff. So we really are, think of us as insiders. We understand how corporations think, and we've employed in our dual clientele model a strategy that really gets the best through a relationship-based approach with our employer contacts. We have partnerships on the left-hand side and the right-hand side. So these are our two sets of clients, the way we look at them. On the left-hand side are our refugee clients. They come from 64 different countries around the planet, and they have come to Canada via various government pathways. They've all been pre-screened for security, for medical. They all have legal ability to work in Canada. It's one of the requirements to become a Jumpstart client. They're all educated. So education is relative, but about 80% of them have university degrees, undergraduate degrees from back home somewhere. About 15% of them have PhDs or master's degrees. So very educated population, and they span all levels of diversity that resonate with employers in terms of those that have DEIB programs. They also span a great deal of expertise. So we are non-specialists. We don't focus on any one sector. Our refugee clients come with a wide variety of skills, and we try to be a bridge over to employers looking for that particular skill set. Our refugee clients tell us that applying on LinkedIn, applying on Indeed, or any one of the tools out there, they send in hundreds of applications. They never get any kind of response back, and they get frustrated because the way they're applying here worked back home, but it certainly isn't getting a result here in Canada. So what we try and do at Jumpstart is we have deep relationships with the right-hand side of the equation. All these employers, either their talent acquisition teams, their executives, their DEI teams, their ERG groups inside, multiple points of contact that we've nurtured over time, continue to establish new relationships. And through those relationships, we're able to pre-screen, and that's key for us, pre-screen our refugee talent for any opportunity that comes up at our employer, and we will send over their CVs to them to consider. Last year, of all the pre-screen referrals we sent into our employer partners, 30% of them ended up getting interviews. You could look at that as a half glass full, half or full, half empty, half full glass. I'm mixing that metaphor up, but you know what I mean. On the half full side, 30% is pretty good in a very competitive job market. On the half empty side, 70% aren't getting interviews. But I think, again, that is a function of a really tough labor market today. The competition is stiff. The fact that we're giving our refugee clients a chance, a fighting chance to get in front of an employer is something we're extremely proud of. The one thing I will point out here, because I would assume there's a lot of nonprofits or SBOs on this call, you'll see a few nonprofit logos on the right-hand side of that screen. Polycultural, Costi, and a few others. So the nonprofit sector in Canada is the biggest employing sector in this country. However, they're fairly small shops compared to the RBCs or the Bells of the world. But having said that, if you are ever in hiring mode, we hope that you will consider Jumpstart as one source of talent to be able to pre-screen and send over to you to consider for your hiring needs. And to help with that, we have created a job board that is specific to the refugee population here in Canada. Effectively, and I'll show you a peek of the actual website where this job board sits. So our employer partners who have given some indication that they are open to considering refugee talent can post through us on this job board. It is not scrubbed from LinkedIn or Indeed. These are specific relationships we have with our employers who have indicated an openness to looking at refugee talent. I'll pull up on the screen so that you can take a look at the various opportunities that are open right now. This is constantly changing as new jobs come on board and we fill other ones. These are all across Canada. So you'll see the sector, the position, the location. So you'll see there are many, many sectors. And again, it speaks to the diverse talent that we have as refugee clients. So before I pass it over to Tony, what I would say is if you are ever in hiring mode, reach out to us. We'd be happy to have a chat with you about how we can get your job posted on our job board. Now, the second model is my colleague Tony will take you through, but I just want to preamble this by saying that this was a model that was created by the National Refugee Jobs Agenda Roundtable. That's a mouthful, but it represents 150 organizations across Canada, co-chaired by Senator Andrew Cardosa. These 150 organizations span corporates, governments, and SBOs, all of whom are invested to some degree in considering refugee talent for open positions. And this model was developed by this national table. Jumpstart's been a leader in trying to promulgate it throughout the country. And again, appreciate P2P for giving us this platform to share this. So Tony, over to you.
Thank you, Daryl. Hi, everyone. It's nice to see you all. So before I talk more about the model itself, I just wanted to share as well a bit about my experience joining different job fairs when I first came to Canada. So I'm a refugee. I came here in 2019. And like every newcomer that arrives to Canada, there's always a challenge when it comes to employment. One of the ways where several people recommended that I join several job fairs in Canada to try to find a job. My experience with those job fairs were it was a bit, let's say in certain cases, hectic, or I didn't get the opportunity, even in some cases, to even enter the event. Especially during winter, I had to stand up in line waiting for the opportunity for me to get in. And even if I'm able to get in at that time, I always face challenges. Employers are busy talking to 10, 15, 20 people at the same time. So at that time, I thought, surely there's a better way to do this. And that's when I joined Jumpstart and I learned about the refugee hiring event model. So we're living in an innovative space. and everything is moving pretty quickly. But job fairs has been the same for years and years. So we wanted to be part of a model that is innovative and to change that model into something that is more action-oriented. So we started taking part of the refugee hiring event, and the first event that we led was in 2022, and that was the Toronto refugee hiring event. But since then, because of the success of the model, we were able to expand to different regions across Canada and work with great partners across the country. So we've expanded to Moncton, and we've expanded as well to Regina, Winnipeg, Durham region, and we continue to run the Toronto Refugee Hiring event on an annual basis. So for today, we're going to highlight the 2024 Toronto Refugee Hiring event, and I want to talk about the different parts of the hiring event. And I want to start with collaboration. It's rare to find an event model which brings together more than 15 organizations in the GTA to work on one specific mission. And that's what we're doing with the refugee hiring event. So in 2024, we're able to get together more than 15 organizations, service providers from within the GTA to support this initiative. And it's not possible without the support of all the agency partners. And this is one of the key steps for it to be successful. The agency partners take, so depending on their capacities, I'd say, they take part of the hiring event. It was led mainly by World Education Services and Wood Green Community Services, with our support as well, because we've supported in building those systems over the years, and we have that expertise in being able to run this hiring event. But everyone involved played a key role in making this successful. So collaboration is a big part of the hiring event, and this is similar across the country. In every region, we run a refugee hiring event, and it's not us running it, we're only supporting, but it's the lead agencies from those regions running the event, because at the end of the day, they understand the context better, they understand the challenges better in those regions, and the hiring event model is very adaptable based on the context and based on the situation on the ground. For example, in the GTA, the English language level is higher compared, for example, with Moncton, where refugees had a lower English level. So we had to adapt and change that. But that's not possible for us to understand without all the partners that were involved on the ground. Next, Daryl. All right. The second part is the employer selection. So for the Toronto hiring event last year, we had 23 employers that joined the event. One of the key things that we discussed with the employers before the event, once we asked them to register, is that we are looking for positions that they're actually hiring for. So this is not a meet and greet. This is not a it's more of a action oriented. So what we're looking for are positions that are active, that employers are hiring for, and we ask employers as well to send people from their organizations that got that decision-making authority. So either a recruiter that is working directly on the position or a hiring manager, if that's possible. And the employers come in on the day of the event and they meet with each candidate on a one-on-one basis for 30 minutes, and it's an actual interview. So it's not a meet and greet, it's an actual interview. The candidates from their end, they've received the position, they apply for it, and I'm going to be talking more about it, but the employers are able to meet with those candidates on a one-on-one basis, have a 3-minute conversation with them, and either move them to a second round or even in some cases offer them an offer on the spot. All right, talking about pre-screening. So as I mentioned, the employers are going to be sitting with those candidates one-on-one. But how do we make sure that we're moving the right candidates for those positions? So what we do on our end is we take those positions from the employers, we post them on a website very similar to the website that Daryl shared earlier, but that it's going to be a website specifically for the hiring event. So we take those job descriptions, we collect all the information from the employers, we post them, and the lead agency works on screening all those candidates and selecting the strongest ones that are going to be invited on the day of the event. We select the strongest candidates, we invite them, they attend on the day of the event, and they have specific time slots on when their interviews are going to take place. And the employers are actually getting better outcomes rather than just meeting with anyone. We're choosing the strongest people that are relevant and got experience. So that is giving the employers a better outcome and the candidates a better experience overall. So as I mentioned, it's very action oriented. So one of the things in a job fair is that it's hard to track the outcomes. We can tell, okay, 20 employers joined, 500 people attended, but that's it. It's very difficult to figure out what happened after that. What we do is we track all the data, all the outcomes. We inform the employers that we need the feedback of those candidates and what happened in the process, so we can collect the success. So for the Toronto hiring event, the success rate is around 54%. In some cases, in other regions, it went up to 89%. So the success rate for us is either getting a job offer on the day of the event or moving to the next round of interviews. As you can see here, around 35 and even more than 35 people were able to get hired because of the hiring event model, and those are confirmed hires. So we know the name of the candidate, the position that they got hired for, and we got all the details. And this is much better when it comes to reporting the outcomes, either to donors or to different partners that we're working with.
Tony, we want to hear from a testimonial from one of our refugee clients that attended one of these events. So just hopefully you can hear this.
Before that, you have some preparation, you have some people to guide you into the process, and also when you come here, you already know for what interview you are coming here, and you have a few ideas about the company you're gonna have the interview with, and also you know the position, the qualification that is required about that, and you can prepare yourself many days before you attend that event, and then hopefully when you come here, you are well prepared and you're expecting that everything will be fine. From my point of view, it's very interesting to have this, and also I really enjoyed today.
Thank you, Daryl. One thing that I also wanted to mention is that we make sure that the candidates are well prepared before the event. So we run interview prep sessions based on the positions that they applied for. We share with them interview questions ahead of time as well, so they can prepare on their own. And on the day of the event, part of the work that we do is that there's something called the coaching corner, where the candidates get support before they join the interview. So there's a lot of support for candidates as well to make sure that they're successful. Thank you, and I'll pass it back to Daryl.
Okay. So looking at PowerPoint slides is one thing. I'm going to take 3 minutes to show you a video of the highlights from the Moncton refugee hiring event, which had an 85% success rate. Many factors, but let me play the video and then we can wrap things up. Today is World Refugee Day, and this event is a refugee hiring event. We want an outcomes-based event where refugees actually get jobs as opposed to a meet and greet, which is what a traditional job fair is like.
The employers that are coming today are coming here with the intention to hire. They have jobs available. The refugees and displaced people, the job seekers, they're coming to interview for specific openings in the community. So they've been prepared, they have their resume ready, they've practiced their interview skills, and so we're hoping today that while we're here, we're going to see job offers going out to these individuals.
Moncton CMA is the fastest growing region in Canada, and 87% of our population growth actually comes from newcomers. Oftentimes, for instance, language barriers might be a major challenge but that certainly doesn't stop them from contributing. So we see here today a lot of interpreters helping candidates go through the interview process, and a lot of them have actually been offered positions.
We have 2 rooms set up at this hiring event. And so in the first room, we have a coach's corner. So when people come in, they can talk to a coach, get some of the nerves out, get a bit of support so that you can walk in the next room prepared and confident and ready to do your best. So our employers are there, they're going through the interviews and meeting candidates.
I'm volunteering today to help with the translations and the interpretation of languages. As an immigrant myself, I know what does it mean to need help. You know, I know the struggle they've been through. To find a job is not something easy, especially if you are not bilingual or you don't speak English. There are a lot of qualified candidates who doesn't know where to go, so these kind of events will be really, really helpful.
Really, what we want to do is change lives. There's a whole stereotype of refugees in camps with knapsacks and that, you know, they basically don't have a lot of literacy, etc. The reality is that many are highly skilled, very experienced. All they need is a chance for somebody to open the door.
My name is Precious Ndo. I come from South Africa and I am here for a job interview. I got to the room where there were coaches. Someone sat down with me and talked me through the whole process as to how it's going to go, what questions to expect. And it kind of put me at ease because it was just the first official interview I've ever done in Canada. So I just saw them now and it went well. They offered me a position as front desk.
There's nothing better than to hear news about a single refugee or many refugees getting jobs. The light in their eyes when they get that offer is really amazing.
Okay, I'll stop there and invite anyone that's interested in learning more to reach out to either Tony or myself. I'll put our contact information into the chat and I'll pass it back over to Alina.
Thank you so much, Daryl and Tony. This has been really an interesting presentation. And as I can see in the chat, lots of questions have already come in, which is great. But as a friendly reminder, I would ask everyone to please input their questions in the Q&A box, which is just separate from the chat. It's just going to make it a bit easier for us during the Q&A period then to go back to the questions. As in the chat, we also have some just general comments. So that would be greatly appreciated. As I mentioned before, we will come to the questions afterwards. So now I would pass on to our next presentation to Caroline and Rebecca.
Hi, everyone. Firstly, I'd like to thank P2P so much for having us here. We're delighted to be here today. I'm Rebecca, and I'm a facilitator and curriculum developer for the National Healthcare Language Program. And I'm here with my colleague, Carolyn, who's the project lead for the program. So our agenda today is just to walk you through the actual program. So we'll take you through what it is, and then we'll show you a little bit about the innovative redesign we've done based on need and the implementation of those changes. Next slide, please. And I'll forego this land acknowledgement just because I'll let the one stand that was at the beginning of the workshop so we can move to the next one. So our partners in the National Healthcare Language Program, which is funded by IRCC, have been really great. We've had these partners for the last year or so. So our partners in Ontario are the Catholic Centre for Immigrants and World Skills Employment Centre. In the Prairies, we have Calgary Catholic Immigration Services. And in BC, we have ISS of BC's Language and Career College. Of course, ISANS is working with the IEHPs in Atlantic Canada. So all of our partners have expertise in the area of workplace communications, and we have contacts and connections within our regions. So between all of us, we cover all of Canada except Quebec. Next slide, please. I'll pass it along to Carolyn, and she's going to take you through our courses in a bit more detail.
Great. Thank you, Rebecca. So this is just a timeline. We've been teaching healthcare courses since 2005. So I'm just going to give a brief description of the program and how it's moved along and the structure as we go through. So originally it was an in-person course with a textbook, and we had everything reviewed by healthcare professionals, and we were teaching all whatever healthcare profession that our clients had. And we ensured that everything was authentic and geared towards the healthcare. Because surprisingly enough, in 2005, this was a need. We needed more healthcare professionals in 2005. So this was an in-person course, and there was also regular site visits. So we took them to hospitals and clinics and things, blood clinics, and they enjoyed that. 2017, all of our healthcare clients expressed they needed more flexibility, and we had tried all these different versions of in-person days. They needed to work, and it was hard to fit in. So we made a major transformation, and we adapted it into blended learning. So we had an online version of the course. We took the textbook content and redesigned it to be online, and then combined it with one class per week, a 3-hour in-person class. So on our little chart, it says provincial, but really because it was an in-person class, it was really based around Halifax, whoever could come into class around Halifax. All the online work could be done at home, so reading and assignments, and it was all sent through the online platform. I started teaching that course in 2018, and I remember our language service manager saying, "Oh, we have to keep thinking about going national." And I had no idea what she meant. But it was a lot about the assessments we were doing and how we were going to approach it. So that informed some of the design. We also had another program at iSANS that had gone national, the SOPA program, Settlement Online Pre-Arrival. So we had a model that was working. So I think they were just putting the thought in our minds in 2017, 2018. In 2019, we redesigned again because we had several of the professions asking us for specific exam prep courses. So specifically the doctors, the pharmacists, and the nurses. They have to take, well, all the professions do, but these ones, they have high stakes licensure exams they have to pass. Very expensive, very high stakes. Some of them you can only take a couple times. So we redesigned the course to help them prepare for those exams, and we were ready in early 2020 to have those courses, and we had to pivot, but we were ready to pivot because during COVID, we pivoted to 100% online. What we discovered with that was we could teach beyond Halifax. So now we could teach students across Nova Scotia because everything was online. So that was really great. We had students from Yarmouth to Sydney. In 2023, IRCC asked us to go national with our healthcare courses. So I think that was around the spring. And then we drafted a proposal in November 2023 and officially started the National Healthcare Language Program in 2024. So all of this work and I guess the pre-thinking helped us be able to quite quickly flip over to go national. And with the addition of our partners, and some of our partners came from the SOPA program, we were able to roll it out across the country. Next slide, please. So the project now, we are focused on physicians, pharmacists, and nurses. So it's international medical graduates, international pharmacy graduates, and internationally educated nurses. So we focused on those, and we're helping them work towards preparing to be licensed in Canada, which is a long, difficult, and expensive process. Next slide, please. So the purpose of our courses are to improve their healthcare communication skills. So it's not just language, it's communication, how to communicate in a Canadian healthcare environment, to empower them to thrive in that environment, working with coworkers and patients, and maybe bridging any cultural gaps. There are definitely differences from where they've come to Canada from. And then also, as I said, we're preparing them for those professional exams. The professional exams are preparing them for working in the healthcare system. So it all works together, that focus. The next slide, please. So the two courses we started, we had one course and then we broke it into two. The first one is communication strategies for patient interactions. This is to help doctors and pharmacists, and in Nova Scotia, dentists as well, to prepare for the specific exam called an OSCE exam, which is a communication exam. And it's focused on communicating with the patient. They have to show that they can do all the competencies for that exams. It's 8 weeks long, 100% online, 2 classes per week. They have to pass in a lot of assignments, and there's asynchronous activities as well. The second one is Strategies for CELBAN, which some of you might be familiar with. It's a language proficiency exam for nurses. It prepares them for working in the healthcare system, and it's specifically for nurses. So all of the exam is based on nursing, which is really, it's preferred so they can do the exam in their profession. This one says it's 52 weeks, which sounds like a lot, but it's divided on the modules: listening, speaking, reading, writing. So they could simultaneously do 2 modules or 3 modules at a time, or just pick the skills that they need to work on. So they might only need to work on their listening, which they need to score very high in the CELBAN. The interesting thing with this course is we had our doctors and pharmacists ask us to start taking these courses, the modules, because it's still healthcare focused, and they wanted to work on their skills within a healthcare context. So now we have lots of doctors taking specifically the writing course, because that's quite difficult. The doctors have to pass an IELTS exam. So they like to have that feedback, and each module has an instructor attached to it as well. The next course, Professional Communication Skills for Nurses. This came as a request from the nurses. They found the Strategies for CELBAN a bit long. If they weren't doing the CELBAN, they just wanted help with their listening and speaking. And it was high. The scores required to take the courses were a little higher. So we took it and we reduced the level a little bit, and we made it so it was only 4 or 5 hours a week that they had to work, and then just 8 weeks. So we find this one's helping people maybe get the higher scores, or maybe they're already even working and they're building on their their confidence level and some of the communication skills they need for work. Next slide, please. So when we redesigned them, we had to think about, because 2 of them were specifically exam focused, we had to think about the research was telling us you needed authentic exam simulation, authentic exam practice. So we added an in-person simulated event for the Nova Scotia part of the course when we were doing before 2024. And now we have an online simulated patients events and AI virtual patients. So I'll go over the first 2, and then Rebecca will cover the next one. If you could go to the next one, please. So I just did this this morning. I was at Dalhousie doing the in-person simulated patients. So for our students in Nova Scotia, we are still doing this. We've been doing this for 5 or 6 years now. So what you see here is what it would look like when they do an OSCE. They're in a hallway, they're reading a little case, and they're going in and practicing with a simulated patient. So we don't quite simulate the exam, but we put them in an environment where they just do the communication aspect. So they work with a simulated patient and they have time to talk with the simulated patient. It's very successful. It's very satisfying as an educator, and also the doctors and pharmacists really enjoy the getting used to the simulation and getting used to how it works and how you move around. So if you go to the next one, next slide, please. So that was one of the challenges when we went national. We wanted to replicate this, but we have students across the country now, and not even just in major cities. So we went online with the simulations. So we also do 100% online. We're able to work on some partnerships with the University of Toronto and the University of Calgary. So we get their simulated patients, they train the simulated patients, and they organize everything for us. And then we run the session on Teams. So it's very similar to the in-person one, but we're doing it, giving people access across the country. So it's nationwide, and it's cost effective. So doing it online is definitely a little bit cheaper than doing it in person. So that's been great. The challenges are, it's been challenging finding the simulated patients across the country. We've had technology issues with Teams, but we've sorted most of those out. We need more staff on our end. So when we go to Dal, we really only need one staff member. Dalhousie does everything for us. They're amazing. And we lose some of the interactions. So the body language and things, we lose that. And the debrief is a little different online than we would do in person. So it's definitely filled the gap. Students are very happy with this, and our University of Toronto and University of Calgary people we work with are amazing, and they believe in what we're doing too, helping the healthcare, internationally trained healthcare professionals. Next slide, please. So I will hand it over to Rebecca for the AI virtual patients.
Sure, thank you. So as Carolyn mentioned, we had to address the challenge of going asynchronous with many of our courses. So this past year, we incorporated AI to make our courses more accessible and inclusive. So due to distance, time, and scalability, we had to bring back that missing in-person aspect of the program. So in addition to adapting our simulation sessions to an online format, our second challenge was that many of the nurses were unable to meet the attendance requirements due to their shift work schedules. So we decided to redesign all the nursing courses to be asynchronous so that they could do that work at any time and still keep their shift work jobs. So as a nonprofit, we had a lot of restrictions. Most companies were pretty expensive, but we eventually found a Canadian company called CyberPatient that believed in our mission to help internationally educated healthcare professionals in their licensure process. So we ended up partnering with them. So I'll tell you a little bit about them. Next slide, please. So CyberPatient is a virtual teaching hospital with over 130 diverse patients, helping the students build real-world clinical skills through guided and self-directed case-based learning. So it's offering them a safe space to move from theory to practice, developing clinical reasoning and those communication skills. So while the platform offers the full spectrum of patient care, which includes the clinical aspects, one key feature we've been using in our program specifically through CyberPatient is history taking. So next slide, please. So with the first virtual patients that students will work with, the system prompts the students to select appropriate questions in a structured format to gather information about the patient's chief complaint. So this structured approach kind of reinforces their theoretical knowledge, but it also helps them develop the skills needed to navigate a real clinical encounter. So we use this to scaffold kind of into the free form version that they eventually go into as practice activities before the assignment. So these are being used for practice activities before they go into a free form assignment. So although there are about 150 questions available, the students must choose carefully because they're only allowed to select 30 of those questions. So they need to decide what are the most relevant questions to ask based on the patient's complaint. So that encourages their critical thinking, their prioritization, the awareness of the clinical context. Next slide, please. So as soon as they finish their patient interaction with the virtual patient, they receive immediate feedback on the CyberPatient platform that looks like this. You'll see on your screen. So that's the structured history feedback. So you'll see it kind of gives them an idea of, their knowledge score in general, how long it took them, and then it looks at all the questions that they used, how many questions they asked in their interaction. And out of those questions, it kind of codes them in colors. So what were the relevant ones? What was irrelevant? So they can kind of see, how well they did and what they asked that was relevant and what they need to omit the next time, and they can practice it again and again. They can practice it many times over, and then the instructor of that course will give them feedback on their last attempt. So that's where they get the specific feedback regarding the skills that they're focusing on in that particular unit of the course. Next slide, please. So as I mentioned, after they use the structured form of history taking, then they will go on to the interacting with virtual patients where they have a free form conversation. So this one looks a little bit different. So you'll see there's a little speak button on the bottom left there next to the virtual patient. So this time the system allows the student to speak directly with the virtual patient using their own question formations and their own language that they've been practicing in the course in that unit. So for students with limited English proficiency, this exercise supports language development by exposing them to both the written and the spoken examples of appropriate culturally sensitive patient communication. So it builds their confidence and it helps them practice meaningful interactions in a supportive setting. So they can make mistakes here over and over again, which gives them that chance to kind of get that nervousness out because they are using it to prepare for, you know, those high stakes exams that Carolyn mentioned earlier. So with this practice, it gives them a little bit more confidence going forward into the actual live interactions. Next slide, please. So again, as soon as they finish their patient interaction with the free form, they also receive immediate feedback on the platform. It looks a little bit different just because of the way that it's interacting, but you can see on the left, you have the full transcript, so they can go back through and see the questions, as well as the instructor can go back through and see what the actual questions were and how they were worded and phrased. So it gives a true breakdown of what transpired in that conversation. And then it's broken down on the right into those feedback headings. So they give some positive feedback, they give things to improve on. And then as you scroll down on that page in the platform, it'll give them very specific things as well. So this is also followed by the instructor feedback specific to whatever skills they've been focusing on in each unit of the course. Next slide, please. So in conclusion, this project has been quite successful so far. We've enhanced our ability to deliver flexible, innovative, and effective healthcare communication training based on need. The needs assessment we did at the very beginning really helped us to know what students wanted and what they didn't want. And so we took that to heart and we tried our best to incorporate it into our new redesign. We've turned challenges into opportunities. So we've used purposeful innovations and technologies to bridge those gaps and offer inclusive and accessible courses. And we're better able to support the doctors, pharmacists, and nurses on their journeys to licensure nationally. Next slide, please. I'd just like to say thanks so much for joining us. And if you have questions, we'd be happy to answer them during the Q&A session.
Thank you so much, Caroline and Rebecca. This was really, really interesting. Yeah, can't wait to get to the Q&A for this presentation as well. So now next, let's go to our next presentation. I believe, Maria, you will be leading the presentation. Yep, so over to you. Thank you.
Thank you, Alina. Good afternoon, everyone. Thank you for being here today. My name is Maria, and I'm excited to introduce you to GNB Mosaic, an initiative designed to create a workforce that truly reflects diverse communities we serve. As many of you know, New Brunswick has been welcoming more newcomers than ever before. And it's crucial that we help them find meaningful employment opportunities with the government of New Brunswick. That's where GNB Mosaic comes in. In this presentation, I will walk you through the program mission, values, and process, showing you how we're making a difference in both the lives of newcomers and the future of Canadian workforce. Let's get started. Next slide, please. GNB Mosaic is a hiring program designed specifically for newcomers and refugees who were not born in Canada, but are seeking meaningful employment opportunities with the provincial government. This initiative is built with newcomers and its center, ensuring that diversity and inclusion are not just ideals, but actions that shape the way we hire and support employees. Our approach is rooted in 6 key values. Flexibility, we adapt to individual needs. Diversity and inclusion, we champion an inclusion work environment. Collaboration, we work together for better outcomes. Better together, we believe in strength of community. Screening in, not out, we focus on potential. Value-based decision, our hiring process is based on values, not just roles. These values guide everything we do at GNB Mosaic, ensuring that every candidate is given a fair opportunity. Our mission is to address the province's skills shortages by modernizing the hiring process within GNB. We take a human-centered approach, removing barriers to employment and enabling the hiring of newcomers and refugees into public service roles. Next slide, please. Our program is built on 3 main pillars. Employment, we focused on job matching and skill-based hiring to connect candidates with the right opportunities. Language, we offer intensive language training, partner with multicultural organizations for interpretation and translation support, and utilize automated translation technology. Community, we take a holistic approach to hiring, ensuring that newcomers and their families are supported as they integrate into New Brunswick. Next slide, please. To be eligible for GNB Mosaic, candidates must be born outside of Canada and have a valid work authorization in Canada, which includes permanent residence or Canadian citizens or temporary residents with a valid work or study permit, including international students and foreign workers. Next slide, please. Here's our hiring process works. So first step, candidate enrollment. Newcomers register for the program. Next one, skills pool sorting, when candidates are categorized based on their skills. Then HR network access. HR teams access our candidate pool through a centralized database or receive weekly updates. Job opening request. Departments request specific candidates or a short list for available roles. Profile sharing. Mosaic shares candidate profiles with hiring departments. Interview setup. HR matches candidates and schedules interviews. And in the results, successful interview. If the interview goes well, the candidate is offered a position. Next slide, please. So GNB Mosaic is already making a significant impact. 4,419 candidates are currently enrolled in the program. 401 newcomers have already secured jobs within various government departments. This program is not just about hiring. It's about creating opportunities, energizing communities, and making our government more inclusive and representative. It's important to recognize that New Brunswick has traditionally not been a multicultural province. And historically, the government of New Brunswick didn't hire candidates born outside of Canada. The progress we have made through the GNB Mosaic program is therefore truly remarkable. By working closely with hiring managers, listening to their needs, providing support, and highlighting the immense value newcomers bring, we have created new pathways to employment that simply didn't exist before. To give you a sense of scale, between 2022 and 2025, over than 23,000 newcomers arrived in New Brunswick, part of them of working age from 25 to 45. And while 501 hires might not seem like a large number for a major urban center like Toronto, in New Brunswick, this represents a historic shift. A significant percentage of these newcomers have found meaningful public service employment, something that was previously unheard of in our province. These are not just numbers. Their lives changed, communities improved, and government workforce that better reflect the people it serves. Next slide, please. Here you can see a map highlighting the home countries of those hired through the program, illustrating the global reach of our talent pool. Through the GNB Mosaic program, 501 candidates from 63 countries have joined the government of New Brunswick, contributing their skills to 14 departments. The program has facilitated employment for candidates from diverse backgrounds, including India, 62 people, Nigeria, 53, Ukraine 44, Algeria 30, Brazil 28, and many more. And next slide, please. So, as you can see, GNB Mosaic is transforming the way we approach hiring in New Brunswick. By removing barriers, embracing diversity, and focusing on human potential, we are making meaningful employment accessible to newcomers and making our public service stronger. So if you would like to learn more or get involved, we would be happy to answer any questions. Thank you for your time and for supporting this important initiative.
Thank you so much, Maria, for presenting this promising practice. Now that we've heard from all three practices, we are turning over to Devin, who will try to bring everything a little bit together to maybe emphasize a few things that stood out to you, Devin. So over to you. Thank you.
That's great. Thank you so much, Elena. Thank you to everyone. Good afternoon, everyone. Thank you to our presenters for generously sharing your initiatives to help support immigrants in achieving meaningful employment across the country. As we've heard from the presenters today, employment is far more than a financial goal. It's a key pathway to identity, belonging, and long-term integration in Canada. Today's presentations remind us that real progress happens when we move beyond siloed solutions and build comprehensive, targeted, and collaborative models of support. So what does this mean for all of us participating in the call today? Well, number one, I think we've learned that integration must be holistic. Employment services need to speak to language, mental health, professional identity, and above all, community support. Number two, targeting specific professions or sectors isn't in itself limiting. It's efficient, responsive, and deeply impactful. Number three, real innovation happens through partnerships, and we've seen a lot of those today. and funders and policymakers should continue to prioritize multi-stakeholder collaboration across the country. First, I'd like to highlight that these programs that were shared with us today don't isolate employment from the broader newcomer experience. We saw employment programs that integrate language learning directly into the workplace or profession, models that combine job placements, cultural orientation, and community support, especially in the public sector hiring initiative we just heard about. Hiring events for refugees that are built around collaboration between employers, service providers, and community groups create faster, more supportive entry points into the labor market for newcomers. These aren't just job programs. They reflect an understanding that employment success is deeply tied to language confidence, social connection, and wraparound supports. Second, today's practices show the power of targeted and intentional programming and events. Targeting specific employers and pre-selecting candidates is highly effective as opposed to a more generic job fair approach. Profession-specific language training, especially in the healthcare sector, recognizes that general ESL simply isn't enough. For internationally educated professionals, communication in a Canadian medical setting is as equally important as clinical knowledge. And I was fascinated by the cyber tool that we showed in AI today, and I think we're going to get that ourselves for our own programming here in London. Likewise, initiatives in the public sector are carving out intentional spaces for newcomers, acknowledging that without targeted intervention, entire career paths remain inaccessible, especially in the public service. And I know how very difficult it is firsthand to get the doors open into provincial governments, municipal governments, and at the federal level of government, even though there are funders for these specific programs. So congratulations. Third, each presentation emphasized the role of collaboration. Government agencies, employers, language instructors, community organizations are all coming together, not just to refer clients back and forth, but to co-create programs with shared ownership and shared outcomes. The refugee hiring events, for instance, were successful because employers were engaged early, not just at the last minute. And that's a critical mistake that many, many service providers make. The healthcare language program works because regulators, instructors, and practitioners are all aligned, and now they're integrating new technology at the same time. And the public sector model reflects a systemic commitment to inclusion from within institutions. What they all have in common is that no single agency is trying to solve this challenge alone, and that help makes them all sustainable. I'd also like to briefly point out a few standout features from each of the presentations we had today. The refugee hiring event showed what's possible when putting the employers at the center of the process from day one. The language-specific and profession-specific language training demonstrated that when we tailor learning to a field, we just don't improve language, we accelerate certification and confidence. And the public sector initiative model is a rare but important truth that government can and should be a leader in inclusive hiring. And it can do so in a way that combines employment, community belonging, and language learning all at once. These programs shared with us today remind us that success isn't about placing someone in a job. It's about opening doors to meaningful, commensurate work that reflects their skills, experience, and aspirations. Thank you to all three of you today and all of the speakers who participated for sharing these practices that are not only innovative, but they're also deeply human-centered. As we all return to our organizations and programs, I encourage all of us on the call today to reflect upon what elements of today's models that were shared can you adapt in your own setting? What could you do to build deeper partnerships or target more precisely? And how might we all move closer to systems where every newcomer is seen not as a client, but as a colleague, a contributor, and a professional in their own right? So thank you very much again for the presentation. I look forward to continuing the conversation.
Thank you so much, Devin. This was fantastic. Now that we've heard from everyone, let's move on to our Q&A period. We have quite a few questions here in the chat. So I think the first question was related to the refugee hiring events, and you may have answered this already in the chat, but the question was, what type of refugees, non-conventional refugees, have an additional challenge that they might not stay, so employers are very hesitant to hire anyone with a 9 SIN number? So Daryl and Tony, I'm not sure if you would like to respond to this.
Yeah, I can take that. So again, I put on my employer hat. What is the pain point for the employer in order to answer this perception? It's only a perception that, refugee claimants may not stay very long. Look at the retention rates employers have today with Canadians, never mind newcomers or refugees. Like, how long does a Canadian stay at a job? That's the benchmark. Now, if that's the benchmark, compare refugee claimants who are currently going through a process review for their case by Immigration Refugee Board. Right now, the backlog is so long, that takes anywhere from 2 to 7 years. So 2 to 7 years, they have a work permit, they can work. If your retention rates are lower than 2 to 7 years, then this is still a pretty safe bet as far as this particular perception about the vagary nature of this talent pool.
Okay, thank you. I think another question for you, Daryl and Tony, is do you follow up on retention rates of those hired at job fairs?
That's a great question. Remember, we're collaborating with multiple SBOs on this event. I know at Jumpstart, we're a small staff, so we don't have the ability to follow up with post-hire retention rates. We are starting to look at that as a commitment to IRCC, but we're looking at 1 year after. Now, that's 1 year after generally placed talent, not necessarily only at these refugee hiring events that we talked about, but that's early stages right now, Elena.
Thank you. Another question was, do you also work with people in trades? No degree, but lots of experience.
Tony, you want to take that one?
So definitely yes. Trade is one of the occupations that there's a lot of interest from employers when it comes to trade. So yes, the challenge comes with the language level. So it really depends on the relationship that you're building with the employer. So for example, I know that an employer hired someone with a lot of trade experience, but not very strong English level. But what they did is they've used, for example, translation, like Google Translate and different methods for them to be able to communicate. And that person was successful. And over the years, they improved their English level. Just from communicating at work and from communicating on a day-to-day basis with everyone. So I'd say like the language level is the tricky part, but when it comes to experience and trade experience, it adds a lot of value here in Canada.
And where we have seen employer success in the trades, but other sectors as well, is if, let's say it's a lower language level, but they hire a cohort of Ukrainians or a cohort of Afghans who speak the language, it is amazing how well they start to co-communicate among themselves in order to, be much more beneficially productive for the employers. So when we talk to employers, every employer is different in terms of how they would approach this strategy, but we try and share that as a best practice to any employer who's on the fence about language levels as a potential strategy they can incorporate.
Another thing that I wanted to add here is sometimes employers put like a companion or a buddy at work for them to feel more comfortable and for them to improve their English level. I've spoken with employers that did that before, and it was a huge success. So it's communicating with the employer and finding a solution together for the hire to be successful.
Thank you so much. I'm just going in the order of how the questions entered, so that's why maybe we have a few more questions regarding our first presentation. Someone else asked, what was the success rate in BC, and what is the process for certification accreditation on Canada for refugees?
So we don't have specific success rates for BC compared to other provinces. But I would say that rule of thumb generally applies across all of those pre-screened candidates we send in. 30% of those that we refer in get interviews, and of those that get interviews, 1/5 get hired. That's just based on data from last year. And the second part of the question, so this depends on the sector. Some sectors like healthcare have far higher barriers of accreditation or licensing than others. But we work and partner with World Education Services in order to get a credential evaluation from their home countries. That helps somewhat for the employer to understand what, the best university in Afghanistan, a degree from that university is equivalent to in Canadian terms. It helps a little bit, but it depends on the sector as well. Some are far more strict and more difficult barriers to accreditation.
And do you also work with SAH-sponsored refugees pre-arrival?
Yeah, so for those that are not familiar, a SA is a sponsorship agreement holder. They're typically organizations like churches or community groups that have sponsored a refugee or a refugee family to come to Canada. The government has a special application process for that. So the answer to your question is, if a refugee has been identified and approved already by IRCC, I'm certainly open to talking to the particular individual, that SAW group, to say, can Jumpstart be of help there? But typically what we do, Alina, is we work with refugees already arrived in Canada through my program that I manage. We have a separate program called the Economic Mobility Pathways Pilot. And these are for refugees outside of Canada who are looking for safe passage. We partner with Talent Beyond Boundaries and Braggelman, which is the world's largest immigration firm. It's still a very narrow pipeline of talent coming into Canada. But if you look at communities like Thunder Bay or Fort McMurray, Canadian employers are really struggling to find and retain Canadian talent in those small towns. The Economic Mobility Pathways Pilot is a IRCC test to see whether refugee talent outside of Canada, who the government interviews and is willing to make a job offer, there's a fast-track visa application for that refugee to arrive on day one as a permanent resident with their family with a job. The process, however, is quite long at this stage.
Okay, thank you for the clarification. I think our next question is for Caroline and Rebecca. So how do you include AI tools into your healthcare course?
Do you want me to take that, Caroline?
Well, I just wanted to say the start has been interesting because we, when we decided to partner with CyberPatient, we just wanted to pilot it first with our instructors and some of our students, and they loved it. So 2 of our students said, let's just give them access to our instructors, give them access right away. While basically Rebecca's been integrating it into the class. So maybe you can explain how you've been integrating it into the classes.
Right. So I think there was a question about like, how do we use the tools? So basically when we had the face-to-face classes and when we had the blended classes, we had those online sessions and opportunities to do role play practice with each other. So that was a key component to them building their confidence and their skills in patient history taking. So when we went asynchronous and we took that part out of the equation, we needed to find something to replace it with. So basically that's where the AI tools came in. And when we found CyberPatient, it was exactly what we were looking for. So we wanted something that we could integrate into the program to replace that role play practice. So now we have, instead of those online synchronous classes together, for most of the nursing classes, they interact with the virtual patient during some of the practice activities that are like integrated into the actual schedule of the course. And then once they get to the final part of each unit, they used to record themselves doing a role play with either a family member or someone, or they would play both roles themselves and record, just the interaction between them and a patient. And now they're going into the cyber patient, virtual patient opportunity, and they're taking a specific question and they're asking and a specific chief complaint, basically, and each unit gives them an opportunity to practice different skills that are in that history taking. So they're practicing a specific part of the interaction each time they go in. So at the end, when they do that interaction for the assignment, they talk to the patient back and forth. So whatever they say to the patient responds. They're very well trained. So they get a lot of great feedback from that, and they're able to actually have a conversation using the language that they've learned in the course and from their own knowledge. And then they can practice over and over again until they feel confident in their submission, and then they submit it as their final assignment submission, and then they get that feedback from the language instructor based on all the communication skills they've been doing in that particular unit. So that's kind of how we've been incorporating it, just so they have that practice to actually have a conversation with a patient. Did I miss anything?
No, I think you got it. And it was really interesting today when I was doing the in-person simulation at Dalhousie. They were bringing up cyber patient and what they had done in cyber patient and how they practiced questions in different ways to see what the AI would say back. So they're using it. These people are all about to do their exam in September, so they are using anything they can get to practice, and this way they don't have to ask their spouse to help them with their homework all the time. So it's been working.
That sounds great. Thank you. And then a related question, maybe or related sort of. How is this different from OSLT healthcare training?
I'm not exactly sure what OSLT healthcare training is. I will take a guess that it's clinical. So the exam that we're preparing them for they have to do 3 main aspects, which is communication, management, and clinical. So, for example, in Nova Scotia, we have a clinical bridging program that they're about to start doing. They do it for 2 months intense. It's I think it's about 3 days full time, and they prepare the clinical. So what we suggest is that they take the communication course first, so they can sort out all the communication issues. And then when they get to the clinical side, they're not thinking about how to introduce themselves or how to show empathy, what words they would use to do that. So it really works well. That's been a challenge once we went national, because then we can't recommend the Nova Scotia courses because they're not national yet. But there's lots of other resources. So for example, there's AMGA in Alberta International Medical Graduates Association. There is ITPO in Ontario, which is Internationally Trained Physicians of Ontario. So they all do some clinical courses, plus a lot of other work. So we started gathering the information across, which is wonderful to have our partners, because our partners can help us connect people in different provinces if it's a provincial program or a federal program.
Thank you. I just saw in the chat, I think OSLT stands for Occupation Specific Language Training.
It's the same idea, I guess.
Yeah.
The 2 of the courses are exam. In education, you're not supposed to talk about exam prep, but really they are. So it's occupation specific, and it's also geared towards those exams as well.
Thank you. So I think the next question asks, what is the cost? So for iSense, what is the cost to the candidate? How may interested persons across Canada apply? Can we get the presentation slides? And the answer to the slides, I can say yes, they are posted on the P2P website, so you'll be able to download them.
I love this question because we're sponsored by IRCC. So if you're eligible, there's no cost. So we're able to accept, there's no cost. You just have to have access to the internet and have a computer, basically. And you can apply. I put in earlier, but you can look up National Healthcare Language Program. The website's in there. And you can email Lucy at healthcarelanguage@isans.ca. We run the Doctor of Pharmacist course. I think I didn't mention this. The Doctor of Pharmacist course runs every month. And I can always add new instructors because we have that flexibility with our partners. So we could even open up another cohort. We've done that if there's been too big of a group coming through. Before the exams, we get bigger groups. And the nursing courses start every Monday. And we have capacity, and we can always add capacity. So we will basically, if you're eligible, you can start the program.
And to add to the eligibility, just specifically, if you're residing in Canada as a permanent resident, if you've arrived in Canada as a convention refugee, if you hold a work permit with the MOME 23 annotation, Atlantic Immigration Program, or the Rural Community Immigration Pilot, or your protective person under Section 95 of the IRPR. Those are all the specifics. We can't take pre-arrival or citizens at this time just due to our funding from IRCC, but hopefully in the future we might be able to look at that. But those are the specifics right now. So basically, if you have your PR and you're in Canada, then you should be good to go.
Excellent. Someone is also asking who your partner organization is in.
It's ISS of BC's Language and Career College. And they've been amazing. Their instructors are amazing.
Perfect, thank you. The next question is from Rocio. I think we may have touched on this before. So what programs help newcomers with educational credential assessment? I think, Daryl, you mentioned before that you partner with World Education Services. So we can probably leave it at that. Maria, a question for you. So how do you prepare public servants to create welcoming environments for the new hires within like the GNB program?
Excuse me, could you repeat, please?
Yes, of course. So how do you prepare public servants to create welcoming environments for the new hires that you hire through your program?
Currently, we have a few programs. It's a onboarding program, mentorship program, HR welcome network, job language trainings also. So yeah, it's a lot. I recommend discover more on our website, and maybe Rochelle can add.
Sure, I can. Yeah, I can add a couple other things that I thought of while you were speaking. One, we have an employee-led resource group specifically for newcomers. There was another thing I thought of too that I just lost. Oh, we do a lot of training with our HR community. The biggest gap that we found was there was a question in the chat around the social insurance number. Like, how do you recognize that someone might be new to Canada? And the paperwork and the IRCC changes all the time. People get afraid of hiring a newcomer because it is more complicated. So we have created SOPs, step-by-step guides. We have one person in our HR team who is there to answer any complex cases and help people. Like, one of our biggest parts of our program is keeping people in New Brunswick. So helping employees through the permanent residency application process. We make sure our HR is equipped to do that and have an escalation point when it gets complicated. Training also does include things like anti-racism training. We have a whole Dimensions of Diversity program that we have created in-house, but we also rely on our partner organizations like the New Brunswick Multicultural Association to provide cultural competency training. So when we brought in a number of folks from Ukraine, we actually had an individual from Ukraine come in and teach several leaders about the difference in working styles and working environment between Canada and Ukraine, so that we could be prepared to welcome people into our organization. I hope that helps answer your question. It's twofold. It's technical in nature in the training, and then also the environment that we create. And GNB Mosaic, under Maria's leadership, continues to make sure that everyone's set up with a mentor that it's ongoing. It's not just about getting people in the door. It's about keeping them here and making them feel like they belong and they have a sense of community.
Thank you so much. I mean, you already touched on it, I think now, but someone is asking, does the government of New Brunswick have an anti-racism policy? So you just mentioned that you incorporate that in your work, but I'm not sure if you want to elaborate a bit more.
Sure. We've done a lot in New Brunswick as it relates to anti-racism. We have a respectful workplace policy, which does cover aspects of the question. But we also, a couple of years ago, hired a commissioner on systemic racism to analyze every aspect of our province, both in the services that we offer our clients and the healthcare system, every interaction with New Brunswick citizens, including being employees of the province. And the current government that we have in place right now is making sure that we are addressing the requirements of, or the recommendations. I think we were provided with over 90 recommendations. One of them is to have a policy specific to anti-racism as a call to action. So that is something that is being looked at.
Okay, perfect. Thank you. Then we have a more general question. So what type of help is available for clients with lower English level but wants to make a living? Maybe we can just take it from the perspective. So yeah, what supports do you provide? I mean, in terms of the refugee hiring events, for example, I know that you mentioned that there's specific language requirement.
Yeah, maybe I'll take that. It's a great question. So I'll separate my answer to two parts. One is the direct referrals that we do at Jumpstart. We choose to focus on language levels CLB 6 and higher. We'll take a 5 if they are able to communicate effectively, because employers insist that they have to be able to communicate in the workplace. So those are for the direct referrals portion of my portfolio. For the refugee hiring events, it really depends on the local community where this hiring event is happening, what the local population of refugees are, their language levels. Tony touched on this. In Moncton, the language levels are slightly lower for the refugee population than in Toronto. So the types of employers that we bring and accept into the refugee hiring event has to mirror or reflect the actual language level. So Tim Hortons was there in Moncton because they didn't require a very high level of English for their frontline jobs. And for the refugee candidates who had lower language levels, it actually was a perfect job because you get to practice English on the job and improve it a little bit. It wasn't your ultimate destination, but it was a stepping stone into more meaningful work. So I don't know if that helps, but if they have lower language levels, like 1, 2, or 3, we would refer them to other agencies that focus on link or other language supports. It's just a reality in Canada. If you don't speak the language, it's really hard to find meaningful work.
Thank you. Does anyone else want to jump in and address? Yeah, Rochelle?
Yeah, I would love to jump in. As an employer, we're an employer, but we also have hundreds of hiring managers, and everyone comes with their unconscious biases, especially when it comes to language. One of the things that we did early on when we implemented the GMB Mosaic program is we set up individuals with an on-the-job translator. So one of my favorite stories is a young woman by the name of Natalia, who, when she first came over to Canada, she was 19 years old. GMB Mosaic set her up with a translator that went to the job site with her every day. And then she also did the language training until she was comfortable and confident. 3 years later, she is still working with the Department of Transportation and does not need any additional language supports and is fluent just within the 3-year period of time. So it's also looking at language we've so much AI these days as well that can really support removing language as a barrier. And we come from a provincial bilingual province. So it has traditionally been one of the biggest barriers for newcomers coming to New Brunswick. Just want to share that perspective and story.
Thank you. Maybe if I could just go to Jennifer McKay's comments and turn it over to you, Caroline and Rebecca. So she was saying that since nurses need to have CLB 9 or 10 question mark in listening, why is CLB 6 used as a minimum requirement, as this is quite low for professions being targeted? So if you could comment on that.
I was talking before I put my mic back on. I was just trying to answer that in the chat.
Oh, I see that now. Okay, I may have been too late.
So, but I can explain it better. As soon as I pressed reply, I didn't like it. So originally CELBAN was a little higher, but right now the listening and reading and speaking, you need to have CLB 7, because in the CELBAN you need to get 8 or 9. So listening, you need to get 9, and reading and speaking, you need to get 8. So we wanted to have a high level so they can achieve the next level. So we're trying to help them get up 1 or 2 as they need to get in the CELBAN. The writing for CELBAN writing, you need to get a CLB 7. So we lowered that one to CLB 6. So we help them get from a CLB 6 up to CLB 7. We don't take any lower because it's unrealistic, as they're saying in there. Jennifer was saying it's unrealistic to accept much lower than 6 for sure, because they have to get so high on the CELBAN. Listening for CELBAN, we accept 7 or above, and the students are getting 8s and 9s by the time they finish the course. The listening for CELBAN is 16 weeks long. And it has audios and videos and timed quizzes, and they're trying to emulate the exam. And at the end of each module, you get to do a practice. We call it iCELBAN. I think it's actually called Institutional CELBAN. And we worked with Touchstone Institute to get that set up. So they get to practice online assessment, similar, not the same, but as similar as we can to the actual CELBAN. And they get, at the end, they don't have an official CELBAN score from that practice, but they do get an official CLB. So they might come in with their CLB 7 and come out with an 8 or 9. But also just the practice of doing that exam. And it's been really interesting. Some people just ace the test at the end, and some people still have that exam anxiety. And so they need that practice of just doing an exam. So that's been beneficial. So for the professional communication skills for nurses, we went down 1 lower because we were having nurses come in that didn't have those 7s, and didn't have the time to devote to the strategies for CELBAN. It's a much longer course, and it's a much higher requirement for what they need to do every week. So we were going from 8 hours a week of work to 4 to 5. We found in Nova Scotia, there's quite a few countries that can come in. They don't need a language proficiency test, but they were still coming in and not feeling that confident in work, and not confidence or skills, or not getting the patience they need from their coworkers. You know, they're often are speaking quite good English, but in a busy environment, people aren't listening as much. So we're finding some of the people are either taking the professional communication skills for nurses because they're lower or already working, or just don't have time for the CELBAN courses. So they're taking the shorter course. And after they take that 8-week course, professional communication skills for nurses, they're often going on to the CELBAN courses because they think, you know, I really want to work on my listening. I need more work. So it's been working really well. But we keep redesigning to try to accommodate the nurses. The nurses, they just are doing everything all at once. And actually all our healthcare clients are amazing. They're taking courses, they're working, they're studying, it's amazing. So we're trying to accommodate them all the time.
Thank you so much. I see that Liz asked a question in the Q&A chat. So she says, thank you for the translator example. So I'm assuming this is referring to the example Rochelle shared. For those of you who have done this, how accepting of this do you find employers to be? Anyone who wants to tackle this question?
So if I understood the question correctly, how inclusive were the employers of having a translator available on site?
Exactly.
Yeah.
Yeah.
Full transparency. We didn't charge the departments for it, so we took care of that within our GMB Mosaic program. So there was no other concerns. and government in New Brunswick, at least, is very, very, very tight with their dollars. So you ask someone to do anything above and beyond what they're already doing. The first question is, how much is it going to cost me? And if there's any dollar associated with it, that becomes a barrier. And I'm sure that's the same with my experience in the private sector as well. But in this scenario, when we were saying we are giving this resource to improve communication, there was no question and no concerns. It worked out very well with the folks that had translators. We even had a gentleman who was working in construction who had one. Like this, any type of position. With the exception of maybe hospitals where it is a crowded area already. Most places can support having a second body to do the translation.
Thank you. The next question asks, any similar opportunities like Jumpstart support for open work permit holders or international students? I'm not sure if you can address that. Anybody has any ideas or knowledge of others?
Not really.
I'll
just jump in. I mean, there may be some limited things offered, but most funders won't fund anything that for international students or temporary residents.
Daryl, did you want to add something or?
No, Devin took the words out of my mouth. I will say, though, if they are work permit holders or international students and they are in a circumstance where we would consider them to be forcibly displaced. So, for example, they're an international student from Palestine or from Sudan, and because of the political situations back home, they just can't go back home. We would serve them a jumpstart, even though technically they're not a conventional or asylum seeker. We would service them as a forcibly displaced person. So we use a broad definition of forcibly displaced.
And I can add something we do in London is, in other there is the third level of government being a municipality. And in London, Ontario, we actually went to our local city municipality after a community grants to fund employer connections, job fairs, networking, et cetera, for temporary residents. We have a large number of international students in London, Ontario, attending Western and Fanshawe. And so, we as an organization tend to serve all newcomers to Canada, at least to the best of our ability, regardless of our funders. But with that being said, there is a limit to the number that we can handle with our current staffing without jeopardizing service to the people we're actually funded to serve. So we did find some very limited funding. We also do the same thing through the United Way for mentorship matching for temporary residents. So there are ways to get some dollars to access to serve these populations, but they're few and far between, and certainly not every immigrant serving organization will deliver them.
Thank you. Actually, very helpful. A question for Rochelle and Maria. So working for the government of New Brunswick, since it's in a bilingual province, is being bilingual a mandatory requirement, or is it a skill to be able to work there? Thank you.
Thank you for the question. Actually, it usually depends on position. If some position needs bilingual specialist, yes, but we have hundreds of positions where we are looking for only English or only French experts.
Thank you. Lisa is asking, this is a question for Caroline or Rebecca. Does cyber patient use Canadian English communication? This is in relation to Canadian workplace terminologies that may be different from US or British workplaces.
That's interesting. I would say it uses Canadian workplace terminologies. It's based on the CEO is an IMG, International Medical Graduate, who's now retired, and cardiothoracic surgeon and UBC prof, and it's based on his textbook. But they've also been working with us to build it out. So that's it's been an amazing partnership, actually. But it's based on Canadian workplace, but it's been used across the world for medical schools. Dr. Kayumi does work in Afghanistan. He's been to Mongolia. The product is used in many places a lot for medical students. But it's been really incredible. I don't know, Rebecca, if you had anything else to add about Canadian workplace terminologies or.
I think I would just say yes, it would be in general, it would be it's Canadian-based company and developed in Canada. So in terms of, I don't know if they specifically chose to do that, but I haven't found any of the terminology to be something that's unfamiliar to me as I've been working through it and incorporating it into the courses. So I would go with yes, that it is Canadian-based.
And Rebecca's been diving deep into the cases, so I think you would notice if they were awkward. So it's incredible. It's a wonderful software that they're getting to. Not perfect, so some of the introductions are a little simple because in the exam that they have to do this very specific way of introducing themselves and getting the patient's name. But the questions, and then there's a whole other end of it that we don't even use. We only use a communication aspect. There's a whole other medical end, and based on the resources are based on the medical textbook. It's huge, and we're using about this much of it. So, but then the students have access to it all.
Mm-hmm.
Thank you. So we have another question for Daryl and Tony. So for your program, do you have a mentorship program to help candidates who have been hired to stay in their jobs, or do you have any plans to include something like that in the future?
So the answer is yes, we do have a current mentorship program. We use it in ways to engage our employers. So someone earlier mentioned ERG groups. Many of the corporations have ERG groups focused on one dimension of diversity, a women's ERG group, a Black ERG group, an international ERG group, so on and so forth. And for us, it's a rich vein to tap into to draw mentors from these groups into the community one-on-one with our clients. Second way is we've started hosting curated in-person networking events at the employer locations. Small, no more than 10 to 30 people on our side and 10 to 30 people on the employer side. These are resulting, even though we don't call it a hiring event, in much better hiring outcomes than direct referrals. So it's something we're going to keep tweaking and doing month over month. So the beautiful thing about this is we talked about unconscious bias on the hiring manager side. When you go to a direct referral, it gets sent through talent acquisition to get forwarded into the hiring manager's inbox. And we never hear through direct referrals the real reason why that referred candidate didn't get an interview. It may be for any number of reasons. Maybe the competition was better. Maybe there was a bias on the hiring manager's front. We just don't know. When we do these in-person hiring events, we get to put refugee talent in front of hiring managers. They may not be hiring in the moment, but talking to an educated, skilled refugee breaks a lot of the misconceptions about what this talent is about. And when they are in hiring mode, they tend to be more willing to consider this person or the people that they met at the events.
Okay, great. I was just checking to see if we received any other questions. It looks like we've answered most of them. If I've missed anything from the chat, please feel free also to raise your hand and ask the question now. In the meantime, I will also include the contact information of all our speakers in the chat in case anyone wants to reach out for further information. Yes, Daryl, please.
Elena, there was a question asked by someone in the Q&A about for refugees wanting to work in regulated profession, is there some sort of financial assistance to pay for their WES credential evaluation? So there are 9 countries that WES has parceled out as part of the WES Gateway program. These are countries where because of the situation back home, it is really difficult, if not impossible, to go to a university in Syria or to go to a university in Afghanistan and get a credential evaluation done. So Wes has made an exception for these 9 countries because of the circumstance. And we at Jumpstart will, on a case-by-case basis, we will make sure that the person from these 9 countries doesn't have to pay for the Wes credential evaluation.
Okay, thank you so much. And I see, Tony, you also just shared the link in the chat. That's really helpful. Thank you. So this has been really amazing. I want to thank everyone for the useful information, all the knowledge that you've brought to this workshop, and also our attendees for your participation. This has been really great. As we mentioned before, so if you would like to review the session, the video of the recording and the PowerPoints will be posted on the P2P website. We will also have more P2P workshops coming up, so stay tuned to be on top of them. You can join the P2P mailing list to make sure that you don't miss out, and you can also sign up for the P2P mailing list on the P2P website, and there you will have access to our e-bulletin with lots of information, including wonderful workshops. So I think this concludes the workshop for today. Again, thank you so much to everyone, and I hope you have a wonderful rest of your day. Thank you.
Thank you.
Thank you.